Now we are on Facebook. Brad. Hi, folks. Come on in. Come on in.
How's my
Join the party. Yeah, finally looks good. Join the party. Join the gathering. Join the fun. Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we have the most famous physical therapists on the internet.
In our opinion, of course, Bob.
The 10 stretches for back pain that everyone should know. Everyone should have these in their arsenal, Brad.
Right.
And we're also going to show one that you should never do. And of course, we're going to do that one at the end.
At the end, so you're going to have to
watch the whole thing.
Bob, do we really want to hold them in suspense that long?
That's right, we do, because we love you. And by the way, if you subscribe to us, if you're on YouTube, and we provide videos on stay healthy, fit, pain-free. We upload every day. Also, if you're not already, and I know some of you are watching on Facebook, we love you too.
Yeah.
Take a chance on us and find us on Facebook. It's Bob and Brad. All this week, Brad and I are giving out positive vibes to all of you who like us.
To the digital world and elsewhere.
Wow, that sounds religious, Brad.
Mm-hmm.
All right, so we got 10 stretches. What we're going to do is we're going to show the stretches first, and then afterwards we're going to do a question and answer session, which we always do.
Right.
And we will answer any question you ask. You know, we even do relationship questions, right, Brad?
Yeah, we don't guarantee good results, but we'll try.
No, we don't have good answers, but we will try.
But anyways, I do want to mention, we got 10 exercises here, plus the one you shouldn't do. But of those 10, try them, and they should feel good when you're doing. Take that one and set it off to the side, and you'll probably find 3 or 4 of these that are going to feel good while you do them as well as afterwards. So keep that in mind. Have a little pad, write down the ones that feel good.
And I would say even further, Brad, that these can be used as treatment, but they also can be used preventatively.
There you go.
So if you're not having back pain right now, there's still some of these that we might recommend to you so that you never do end up with back pain.
I think they call that a win-win situation.
That's right. Win-win-win, baby. Okay, let's talk with the first one, Brad. I picked this one as number 1 because this is one that I found almost universally everybody can do.
So people who are older and have a hard time getting around with tight backs, or someone younger.
Even if you're bedridden, you can actually do this one. So, and it's real simple. You're actually going to get the back moving and the hips. So it's good for hips too.
Right.
I just had a lady yesterday. She's going to be doing this one.
Okay.
Because she has a tight hip. So all you have to do is you have to find out. You can do this on the bed. You can do it on the floor if you don't want to do it on the bed. Brad's going to give me a pillow. What a nice guy. So you're going to bring your hips, your feet up like this, and you're just going to rotate back and forth like this. And you start off a lot of times with just small arc.
Right. So I got the small motion, and it should feel good. If there's one direction that hurts, which is not uncommon, go the other direction and repeat it to the left, say, for example, and then come back and go to the right. And a lot of times you'll feel it start to loosen up.
And then, eventually then, as it starts to loosen up, you might go further and further.
Right.
Now, this is something, if you're having back pain, you can do it a number of times a day. You can do it 3, 4, 5 times a day if you like.
Right.
And you can, move it further and further. You just need to do it for a couple minutes. And eventually you can actually go all the way over to the side, keeping your shoulder down.
Right.
And if you really want to stretch,
look at that hip motion.
If you really want to stretch, you can bring the foot off here, but just don't go off the bed here.
Right. Yeah.
So,
if you're doing it on a carpeted floor, is oftentimes really good as long as you can safely get up and down.
Now, the higher you bring your feet up closer to your buttock, the higher up it's going in your back.
Sure.
So if I go like this and now I go like this, now I'm way up into the mid back here.
Do it the other direction, Bob. I know your leg's going to might hit, but I can show. So we're getting in that low back, but also the upper low back, and then a little bit the thoracic back too.
So again, this is just a good universal one. What we find out quite often with back pain, one of the things it starts to hurt. So what you do, you don't move it, right? Mm-hmm. You splint it. You keep it from moving, and then everything, the toxins build up and the pain builds up. And so we want to get movement in there. We want to get blood flow to it. That's why we often recommend walking with back pain too, because it just often helps with that.
Again, and that's why there's 10 options, because you'll find some that irritate it and you don't do those, but the ones that you can get that movement going without pain, that's going to increase the circulation and do exactly what Bob said for improvement.
The other thing we find out with quite often, this is probably the number 2 one that I really like, is that people throughout the day tend to do a lot of bending forward or flexing forward or sitting. Yeah, Brad's going to show how when you're sitting.
Yeah.
So everything is with the spine bent forward. So what we have found, and many people have found, but we had to discover this, is that by bending the back in the opposite direction, you actually help decrease the pain and you actually help increase the spine mobility.
Yeah, we can't really take credit for this.
No, we can't take credit for it at all. We did.
Yeah, we're following at Robin McKenzie probably gets the
Right.
biggest majority of the credit.
We're on the shoulders of giants, Brad.
Right.
That's the saying. Right?
Wow.
Yeah. So
Did you
anyway,
think of that yourself?
no, that's I stole that one too.
Oh, great.
So, okay, so you're gonna start off with you can actually just start by laying down like this, and eventually you can
Right.
do what we call a prone prop.
Sure.
Where you can just get up on your elbows, especially if this is new to you.
Right.
There's certain people aren't going to do this, Brad.
Right. If you're diagnosed with spondylolisthesis or stenosis, this is something you do not want to do. It's going to be the wrong
Probably
direction.
make things worse.
Right. I just lay down one flat, Bob. A lot of people don't realize, but when you lay flat, you're already starting to reverse the curve.
Right.
So that's why for some people, this is where you might start, and then it'll loosen up, and then prone on elbows.
A prone prop, and then eventually you're going to take your hands and put them right underneath your shoulders, and you're going to start doing press-ups here. Now, the key with this is that you don't lift your butt up.
Right here.
Keep your butt down. Keep your pelvis down, I should say. And you're going to work your way up further and further, and eventually you're going to find out, you're going to get this far, and then my pelvis still starts to come up.
Get down, get down.
So, to really keep working to the point where you can actually get it up to this point. Again, what you're looking for is that your pain is feeling better. It's getting narrower. If you have pain down your leg, sciatica,
Right.
the sciatic pain should be coming up and going away. You know?
I just worked with someone this morning with sciatica, and if this one doesn't work and you have sciatica, you're going to want to watch some of our videos on sciatica because we have some modifications that we don't have time to go through. And in his case, I found the first modification I tried
Worked right away.
Yep.
So yeah, there's a lot more things. These are just, again, stretches for everyone.
Right.
So
Exactly.
So again, this is a go-to one. I do this one twice a day. I do it in the morning, right before I do my run.
You just do one and then that's it?
No, I do a set of 20, Brad.
Oh,
And
just
then
clarify.
And then at night when I do my core workout, I throw some of these
You
in.
do 20 reps.
Yes, I do 20 reps. Why, you don't believe me?
No, I believe you. I usually recommend 10, but 20 is
You
fine.
doubt my veracity? I want to use a big word on you
That's
there.
exactly what I was thinking.
All right, another one, Brad. Again, because you spend so much time flexed in the chair. You want to show this one, Brad?
Yes, I do.
So there's that. There's a lot of ways you can do this, but this is a great way to do it, is with a ball.
And the ball should be a squishy one, about 6 to 8 inches in diameter, a squishy one. And we're going to get that ball right here. And you need a tall back, and the back of the chair should be relatively firm. In other words, not one that goes way back when you lean back into it. And I'm going to just arch my back. I can bring my hands back here. If your shoulders don't allow that, you can just bring your hands here or here. And then you can adjust that ball up or down. And, we've shown this before many times, but we just can't overemphasize it. And it fits this genre, so we have to make sure we're complete. Oh, Bob.
I just had a friend that came by.
Yeah.
She used to work for me, and she was having trouble with severe pain. She's a school teacher. All I had to do was that. And she just sent me a card and a thank you.
Really?
So that took away her pain. That's all she's been doing.
Did you get like a gift card?
Yes, she did. She gave me a $20 wine gift card.
Oh, no kidding.
Because I must wine a lot. It's always, our favorite day is Wine's Day.
Oh, Bob, it's killing me.
Okay,
Let's
next one,
get
Brad. You wanted to show one you're going to do for spinal stenosis. Brad has spondylolisthesis. So this is, if you have spinal stenosis, we told you not to do the other one. Well, we got to give you one you can do, right, Brad?
So oftentimes, if you have stenosis or spondylolisthesis and stenosis go together. I have both. So these do fit together well. And simply, you can do this on your bed. It's not a big deal. Or carpeted floor, probably be a little better at home. But on your bed's not bad. Both knees up like this to start with. And just start with one knee stretch to your chest. And just bring it straight forward. We're not going to go across. We're going to go straight forward. And you can do that 10 times. But make sure you do both legs. It should feel like a very comfortable stretch. If it hurts, there's something going on. If it hurts the first time and then you do it 3 or 4 more times, and each time you do it, it gets better, well, then it's good. So it should feel good when you're done as well as when you're not done. Now, if you have a hard time getting your leg up like that or reaching to help pull, that's the time to use either a belt or we recommend a stretch out strap because it really works well. Because if you have a hard time doing this, it may mean, you may have weak hands or arthritic hands. And then the wonderful benefit of the stretch out strap is you can put your hands through here and then you don't need to have any grip strength or very little grip strength. And then you can see I can pull like this. I can lock it in.
And I have a lot of patients with short arms and they can't do this stretch very easy.
Right.
So it actually works out good. And you can use a belt or a rolled up sheet too to do this.
Yeah.
But the strap just makes it a lot easier to pull foot forward like that.
Now, right now, this feels really good on my back. When I get up in here and I flex, I'm pretty darn happy right now.
Now, for a lot of people, this may not be a good stretch, though.
Sure.
Especially if you're having problem with sciatica, I wouldn't do this one.
Right. Again, it needs to feel good while you're doing it, and when you get up and leave, it's like, oh, that was a good stretch.
Now, this is Brad's favorite stretch as of late. This is the one that he loves. Again, for someone with spondy
Or stenosis.
Yeah, he gets a foam roller, and he gets it up under the kind of right where the sacrum is, right?
Right. It's
Right
below
here.
the belt line. You're putting it for sure into the sacrum area. You're not going to put it at the belt line or above for sure. It's got to be low, like it's just about ready to slide off your
The
butt.
sacrum is a triangle, right? If you can see that on me or not, but it's right there, a little bit below the belt line in the pelvis.
Yeah.
So,
And then you can do it with this, the single knee to chest or the double. If you don't have a 6-inch roll like this, they work really well, however. You can roll up a tight towel roll like this and use that at home too. And that works not as good, but it still works. So use that. But if you find that this helps and feels good, eventually you're going to get one of these because it really is handy. Make sure you get the ones that's soft, not the hard one, because it won't be very comfortable.
yeah, that light blue one, we have it in our Amazon link. You'll find a lot of people really like that one.
You better believe it.
Well for them. Now, the next two stretches, these are muscles that if they're tight, they actually can pull on the spine and compress it a little bit, and it even puts you into an anterior tilt a little bit if you have the hip flexor tight.
Sure.
So, but we're going to talk about the Quadratus Lumborum first. The way that's positioned, it actually can kind of compress on the spine. This is what I just started doing, Brad. I do it along with my hip adductor stretch, actually. But I wasn't going to show it on there.
Why? Well,
You want to show it?
You stretch
Go
away.
All right. So the simple way to do this is just put your arm over here, put this one over here, and bring this one over like this. It's a good way to stretch it. The pelvis is kind of set. Brad likes doing it in a chair, so you can kind of grab onto the chair there.
A chair with a hand
Yeah.
armrest here. You can grab across here, and then I can lean on that.
That works really nice.
Yeah.
That's an excellent way to do it. And I'm going this way here and stretching that way. Yeah, what's nice about that one, Brad, you can do it in your chair.
Right.
You can if you're sitting watching us right now, you can go ahead and do it.
Yeah. Should feel good.
Yeah.
And if it doesn't, wait for the next
people
one.
question you, say, I'm stretching my Quadratus Lumborum. What do you think?
The QL.
Yeah, QL.
Yeah.
All right.
Let's go to number 6.
Next one, the same thing, hip flexor. When you sit a lot, the muscles that flex your hips, they go up into the pelvis, and they can actually pull you over.
Right. Flex your hips means bring your knee up.
Yeah.
So,
So we're going to want to stretch that. One of the best ways, the easiest ways to do it, and the way I do it, is I just throw a pillow on the floor. I kneel down like this, and I put this one forward. I'm stretching this muscle right here, and I'm leaning forward. Now, if you want to put a little more stretch on that, move the foot out like this.
right here, you're bringing it towards you guys.
Now that really gets it in there. That's how I do it every morning.
See, he's up nice and tall and straight, and you can feel that stretch there. It's a nice stretch,
Yeah,
but
you
you
do
really
both
do
sides.
get a cushion for your knee because it's not comfortable.
hard floor. I don't care who you are. That's not going to feel good on you. So, all right, next one, Brad. You want to show a hamstring stretch? The hamstring again attaches. If it's tight, the hamstring, it's going to make it difficult for you to bend over correctly, keep your back straight when you're doing lifts. So you want to make sure the hamstrings. It's funny because I saw a study and they said there was 3 stretches that were critical to do for back pain, they found out that helped, and hamstring was one of them.
Yep. Very common.
And QL was the other one, Quadratus Lumborum.
Bill, QL, and the HS. Well, you want me to show which way you want to do it?
Yeah, maybe you could go to work here, Brad, and maybe do something.
Well, you know,
there's a lot of different ways to do this.
There is, and this is probably the best way to stretch your hamstrings without stretching your back incorrectly. So you isolate, and you can use, you know, a towel roll like this and go under your foot and stretch here, pull back. That works. I got the stretch out strap here. These aren't real expensive and they really come in handy, but boy, it's great to use, particularly on this stretch, because I'm going to put it around my toe, and then I'm going to take advantage of these handles so that I don't have to grab and pull. I can be much more relaxed with it and pull.
This is where these pants with the stripes that really come in handy, Brad, because you can see really well that he's stretching. You're bending the knee a little bit. He's bending, he's cheating a little bit.
Yeah, this will be a tendency. I'm exaggerating here, but I'm going to try and keep it locked out. And then, you know, if you take your toes and you pull them towards your nose, that becomes more uncomfortable, but that doesn't stretch your hamstring anymore. So don't think that that's better that you pull your toes, it hurts more.
That's actually getting the heel core stretch, which we're going to be talking about next.
Yeah.
But it's actually not a bad thing to do if you want to do both.
Right.
But
that feels good.
You still awake?
I'd like to do the other leg, but we got to get going.
All right, where's our? Oh, here it is.
What?
Our incline board.
Oh,
so
are you inclined to say more?
Yeah. Now again, you're gonna think, why are we stretching the calf muscle? Why does that have to do with the back? If your calf muscle is tight and you try to lift correctly with your back straight, the heels are going to come up, and now I'm unstable and I won't be able to lift it real well. So I'll start rounding out my back in order to keep my heels on the ground.
So it's interesting how the hamstrings and the calf muscles are so important for your back.
For your back, yes, because we want you lifting correctly. So your heels got to have enough flexibility, enough stretch in order to get down to that position. And I mean, you can get one of these, or you can go off the edge of a step.
Right.
I mean, Brad and I really like these. Brad made these, and he made one for me. What a nice guy.
And your son's got one too.
My son's got one.
My daughter's got one.
Yep, and we use it all the time. I use it every morning.
You know, if you don't want to make one, you could just go to our favorite products, and we have them listed there. A nice one at 24 degrees, which is a good angle. So look at that stretch, Bob.
I have mine always next to the railing of my steps,
and
I just hang on to the railing of my step, and then I'll just do one at a time even.
Now, do you keep your knees straight or bent?
I do it both ways.
Right.
I do it with the knees bent and with the knees straight.
Yeah.
And that's getting a little bit different muscles, so make sure you do it both ways.
Be complete. Do it, you know, all these stretches you can do, you know, a set of 3 to 5, you can go up to 10. It's going to go by how you feel and kind of how much time you got before you go to work.
All right, next one, Brad, is actually an advanced one. We're going back to the prone press ups, but we're doing it with actually some overpressure. So now you get in this position, and you can take a stretch out strap, or you can take a sheet, something.
You could take this sheet and do the same thing, but it is easier.
I can put my hands in the loops here, and now I'm going to go ahead and give some overpressure on my back, and it's actually giving more stretch to my back while I'm in the extension. So I can move it up and down the back a little bit. And
I do want to emphasize, when you're doing this, it really has to feel good while you're doing it. Do not do this one if it irritates your back, or particularly if you would by chance get some pain or whatever down your legs. So it should feel like a good stretch.
Yeah, and it does feel good to me. I'll tell you that. And I'm actually moving up even to the mid back a little bit.
So he's moving that strap from the lumbar and moving up. So he's segmentally stretching that back, and
getting different sections of it. Good word, segmentally.
Segmentally, yeah. I remember that one from school, Bob.
Wow, you are.
There's not much I remember from
He's semi-genius. I'm semi-impressed. Okay, next one, Brad, we're going to talk about is the foam roller for the mid-back.
Yes.
He used the foam roller for his low back for the spinal stenosis. Do you want to show it, Brad?
Yep, I do. Now,
your blue nice.
Yeah. Now, the foam roller, we're doing it on this table here, which is soft, but you're going to want to do this one, not on a bed, not on something soft at home. We're just doing it so it's easier to see. On a carpeted floor works the best. So you got to get it down. So we're talking about the thoracic spine, Bob.
Yeah.
So we don't recommend using this on your low back. It's too aggressive and it just isn't comfortable. But here, oh, Bob, this is good. This is always a comfortable one for me to do. And sometimes it hurts a little bit, but you can tell it's a feel so good hurt. Ooh, just cavitated very nicely. There we go. We got any questions, Bob?
Yeah, we do, but I was going to show one more, Brad, by the way. If you want to do it.
Oh, we still got to get to the one big one they don't.
Oh, yeah, that's right. If you want to do it a standing one with, you can do it with a sheet or again, the belt here. You can actually, I'm pushing straight up to the heavens here.
Yeah.
And you can actually work the mid back pretty good and work different segments here. The strap works really good for this because it's got that nice edge on it.
Yeah,
it kind of bites in and really gets in different sections. All right, the one stretch you absolutely should not do, and this is the one I've seen people do for many years, is stretch to try to reach their toes. Very hard on your back. If you want to make it even worse, reach to an opposite side, bend and twist.
Right.
That is how you blow a disc.
Sure.
If you want to blow a disc, if you want to, get a herniated disc or a bulging disc, sciatica, go ahead and do that stretch, and you'll be coming and seeing us soon.
Yeah.
So
yeah, it's one of those that I was in public, at a track meet with a bunch of people, and this guy says, "Boy, that back is killing me." He sits all day in a skid steer, so he said, "I got to stretch it out." And he's doing this stretch, and it's like, oh man, you've got to go the other direction.
You got to go the other direction is right.
But it's not going to happen in a situation like that. It couldn't help him.
Okay, Sejan Matthew said he got an MRI report today, and it says he's got discontinuation of the anterior cruciate ligament. In other words, he's got a complete tear. He's wondering if that will heal, and it's very unlikely that will heal. If there's not any,
what does he have?
Anterior cruciate ligament, ACL. It's a tear. It's a complete tear. Yeah. If there's a complete tear, it's unlikely it's going to heal because there's, if it's a partial tear, it's got a chance.
Right.
But it's floating around in there. Those two ends can't find each other.
Right.
And it doesn't mean you have to have surgery. Sometimes people can get by.
Well, wasn't there a professional football player who had an ACL complete tear, and he played football like that?
Did he?
But you really got to work your hamstrings.
Yeah.
Your hamstrings. It's not recommended.
No, it's not. To be honest, most people, especially if you're going to continue with any sports at all,
right,
it's going to be recommended. And the rehab's not as bad as it used to be. It's still very intense, though, and very intense surgery.
All these orthopedic surgeries are really coming along in one ways in the last 10 years.
So I have L4, L5 surgery 2 times in 4 months. I have cervical bulging and herniated disc. This problem, what type of exercise can I do?
So he had L4. This man had L4, L5 surgery times 2, twice.
In 4 months.
And plus he had cervical
bulging,
cervical bulging.
Boy, that is one that I'm afraid to offer advice over the internet because there's so many variables. You need to have information from the surgeon if there's any things that should not be done or things to work on. That's a tough one to make.
Generally, as a rule of thumb, this is a person that's going to start off with stabilization exercises.
Right.
And we've got videos on that, especially the real beginning ones, the ones that, where you're just doing, this type of thing, maybe doing bridging or something like that.
Right.
But again, you're going to want to get that cleared with your doctor,
right,
and say, can I start lumbar stabilization exercises? You're not going to want to be doing the ones we did today.
Right. Those are going to be conservative. You need to go to your surgeon and get that list. And if at all possible, work with a therapist and make sure you don't undo what the surgery did.
Someone mentioned on here, Brad, I saw it earlier, that when they bend forward, they get a burning in their calf. And that's often a sign that it might be sciatica. You bend forward, it causes burning in your calf. That's a good sign that the nerve might be getting pushed upon, pinched upon. So you're going to want to do the McKenzie approach, which again is getting down and doing some extensions like that, and avoid that bending forward. And like we said, that's the bad stretch to do.
And also seated posture is something else that may be a contributor to this. So lumbar support. Boy, I just was working. I think the guy that's working for us now driving. he drove from California to here in his Mustang, and he said he's getting pain down his leg just sitting in his car.
Yeah,
And I sat in this Mustang, and boy, that thing is made to hurt your back.
sure. There's a lot of
So-
seats that are really bad.
He
Yeah.
will have a lumbar support on his way back.
Oh, that's good.
Okay, I've been an RN for 25 years now, have OA and RA, one of my areas in my spine, and have quite a bit of pain. I hope this exercises will help.
So she's got rheumatoid and osteoarthritis. She's
Sure.
a former RN? A former,
Been an RN for 25 years. so
she's
she
been an
must
RN
have
for
been-
25 years. So,
Well, I think this list of 10, she should go through and do just what we said. Do the ones that make it feel better, particularly after a few repetitions. With the arthritis, at first, first couple, 3 repetitions, it may feel a little stiff, but as you do more, if it feels better and better, then, you're going to put a green light on that. But if they irritate you and you do, like 5 of them and it's just getting worse, scratch that extra.
what I've always found about arthritis is movement generally is really good to a certain point. Once the arthritis gets so bad that any movement bothers it, then I had a lady, she had this much movement in her shoulder, and any movement at all just fired it right up. Unfortunately, that's to the point where you either get it replaced or you just have to almost keep it immobile.
So as an RN, she should have pretty good judgment on the severity that it's now at. So hopefully it's in the earlier phases of it versus the later, more critical or painful stages.
Advice on getting rid of clicking shoulder.
Advice on getting rid of clicking
Clicking
shoulder. That crepitus, we call it crepitus in the therapy world. If you have no pain with it and it's a movement, don't get too excited about it. A lot of shoulders click with movement.
The thing I like to try often with it, because sometimes you got a ball in a socket and the ball might be moved forward a little bit,
Yeah,
and that's causing a little grinding in there.
sure.
So I'm a big fan of this stretch here. What I should do on the end here.
Around there.
So what you're gonna do is you're gonna take the shoulder, you're gonna put the hand down on a countertop.
Try the
Actually,
other arm. Bob.
this countertop would be good. I'm gonna put it on the countertop and I'm pushing down into the countertop. And as I push, I walk backward like this. And this is helping set the head of the humerus down in the socket.
Sure.
I'm pushing down, I'm still pushing down, I'm pushing down as I walk back even. So I'm pushing down the entire time and I go back as far as I can, pain-free, and I push back again. And then it's a sneaky way of getting motion for one thing. If I were to stand up, it's like this. But it's helping set that down so there's less crepitus. And a lot of times I've had people do this and it takes away that noise that they've been feeling.
Okay, so whatever's making a noise, we're clearing the space. Again, do that one. It should be pain-free. If it makes it worse, for sure, then it's not the one for it. But
Someone had asked the question, Brad, actually, if they have a shoulder impingement, how long does it take for it to heal? Well, one thing, it's not going to heal if that shoulder is forward and you're still getting impingement.
right.
You have to stop the impingement, and then it'll have a chance to heal, and then it can heal fairly quickly. It can. The
In a
pain
few
can go away.
weeks,
The
right.
pain can go away
Right,
fairly quickly.
right.
So we do this one, but we often also throw in some strengthening. Brad, do you want to maybe show, especially
Sure.
the external rotation?
Right.
So he's got the wall anchor here, which works out really good for shoulder rehab. And
Yeah, so this exercise is a go-to exercise for vast majority of shoulder rehab or impingement exercises. There you go.
a lot of
Thank
times
you,
we don't
Bob.
want to cheat.
So you put a towel right here with your elbow. If the towel drops out, your elbow is too far from your body. So we're going to maintain proper mechanics using a towel for assistance for that. And we're going to work it like this. But, with the band, it's so much easier in the wall anchor. You can make it easy here. As it gets stronger, you simply take a step away, increasing the resistance. Usually 10 to 15 reps, 2 to 3 sets as it gets stronger is a good frequency for that.
Someone's asking how much time does it take to get a cure from a herniated disc? The herniated disc, it can take a long time for it to heal, but the pain can go away rapidly. If you're doing, the McKenzie program, which we recommend, where you're getting down on your stomach and you're doing extensions, you might be able to get reduce the pain within a week,
Right.
and maybe even eliminate the pain in a week. But the disc is still damaged, and it could take up to a year to heal. So you got to be careful, and avoid the things that are going to cause it to be worse, which is flexion or sitting. Like
for example, right? If someone has this problem and they do the exercises and they're walking, it feels fine, but then they go sit in their car, which has a poor lumbar support.
Yeah,
then they take one step forwards and two steps back, if you will. So you have to maintain all the irritants and eliminate those on a daily basis, and then things will heal much faster.
Yeah, watch our playlist on sciatica,
Mm-hmm.
and you're going to get educated on a lot of different variations of things you should be trying and not trying.
Because it's not two or three answers to the question. There's so many variables. You really sit down and get a big cup of coffee and start watching.
That's right. Watch away. Lonnie, you got anything else?
I'm 20 and I was in a really bad car accident a little over a year ago. And then they said I'm going to have long-term back and neck pain. So any good stretches for lower back and neck?
So this lady's 20. She was in a car accident, and they're saying she's going to have long-term back and neck pain. First off, don't necessarily accept that just because they say it.
Yeah, that drives me nuts when someone
they do that.
forecasts, and then you're setting the person up psychologically for poor results.
Excellent point, Brad. I think they start saying, well, I was hurt, so I need to be hurting. And you don't want to have that mindset. You want to have a mindset, no, I'm going to go ahead and I'm going to be as much movement as I can. I'll be as active as I can. And quite often, surprisingly, a lot of people don't get the pain that they said they're going to get.
Right. We're not saying you're going to go out there and run a marathon.
No.
You're going to have to go dissect the exercises and take this.
Figure out which ones work.
The gentleman you just talked about, what is he, 90 years old?
Yeah, 90 years old, the guy yesterday.
I bet you he's got an attitude. He just continues to do what he can do.
He does, and he's been doing exercise, and he says to me, even he had a shoulder pain. He goes, if I don't do my pulleys, I feel the pain right away in my shoulder. But as soon as I keep him moving with the pulleys, he goes, the pain goes away. And he was thrilled that I was giving some more exercises. He was like, I love this because this keeps my joints moving.
Right. So that this person, again, become educated, learn what exercises you can do that make it feel better. Like with the list of 10, there might be 2 or 3 exercises that we gave today that really make your motion better. So be smart about it. So be optimistic.
Optimist. We better wrap it up here, Brad. We're running at a half hour here. We want to thank everybody for watching.
All
and
right.
we will go live again next week. So thanks.
So in the meantime, we'll be not live.
We're not live for a whole week.